Again, welcome today for the June module, Medicaid non-MAGI programs for 65 and older or disabled individuals. So we're going to start off with introductions. Today you have some of us from the CPOP team and our policy team here. I will begin with my introduction and then pass it off to my colleague Deanna. So my name is Denise Pisa. I am one of the regional outreach coordinators for the Willamette Valley, and today a part of the team that is presenting the module information to you all. So I'm very happy to be here. Deanna.
Thank you, Denise. My name is Deanna Simon. I'm one of the regional outreach coordinators on the community partner outreach team. We also have other folks here. We have Cristina Hernandez, and we have Jessica Diaz, and a whole team of people backing you up and bringing you information. So thanks to everyone. And pretty soon we will have Janelle White from our policy team, and we are just getting her connected.
Thank you. And Cristina, would you like to introduce yourself?
Hi everyone, I'm Cristina Hernandez, and I'm the ROC for the Southern region, so serving at Jackson, Josephine Lake, and Klamath counties. Nice to see you all. And have we started the recording yet?
Yes.
Okay.
And Jessica, would you like to introduce yourself?
Hi everyone, my name is Jessica Diaz. I am the Provider Outreach and Engagement Strategist working on the CPOP team, and I'm excited to be here and help you with your questions.
Thank you, Jessica. And as Deanna mentioned, we will have Janelle joining us shortly. So we'll move forward with the information for today. But as Janelle joins us, then we'll be able to have her answer some of our questions. So we're going to pick up where we left off last month, and this is going to be a series of modules to cover the medical programs in one. It's not for you to have to understand eligibility, but to provide you more information. As we know, one will ask the questions it needs to determine eligibility, and one may ask different questions for different applicants. So we're going to go to the next slide. The reason that we are providing this topic today. So as we know, the one system now contains medical programs for everyone. We know that many of our assisters are helping more people who are 65 and older or who fall under the category of having disabilities. And so we want you to understand what is available to them. And people receiving Medicare may be eligible for more Medicaid programs. So today we're going to talk about two common programs, which is OSIPM and MSPs, and we're going to share some scenarios with you. This is a particularly important topic because, like I mentioned, there are a lot more programs available to more people than in the past. We will go to our next slide. And this is a fun fact for everyone that one does screen for 45 different medical programs, and you can apply for all of these programs via the upgraded one system. One of the things that is important to know is that these programs, all 45 of them, have different eligibility requirements. So one is going to evaluate for all of the programs and then give the highest level of benefits an individual is eligible for. And if a person doesn't qualify for the first program that they apply for, then they are considered for the others and so forth. And I am going to hand this over to my colleague Deanna so she can continue with the presentation. Thank you.
Thanks, Denise. So one thing that we want to review is that all of these programs that are contained in the one applicant portal system, or the one system, fall into two major buckets or umbrellas in this case. There's the MAGI benefits and the non-MAGI benefits. So MAGI stands for Modified Adjusted Gross Income, and it refers to the income criteria that we use to determine eligibility. For the MAGI benefits, one of the big differences is that we look at income only. We just look at this point in time. For the other bucket or grouping of benefits, we look at income and resources. And we did have a whole module last month on the difference between MAGI and non-MAGI, which you can review by visiting group site and pulling up that presentation. But this is a quick review just to make sure we're all on the same page. So under MAGI benefits, we have programs for people who are not disabled, for adults who are not disabled up to 65 years old, for children and for pregnant individuals. So that is the OHP Plus for non-disabled adults up to 65 years. We also have OHP CALM, which is the emergency only version of that. It's a limited benefit package for immigrants who don't meet our immigration criteria or our citizenship criteria. But we do have OHP CALM Plus for pregnant individuals, which is full benefits regardless of immigration status. And under MAGI, we also have long-term care option. So you can be on MAGI benefits, and if you need long-term care, you can get those services as well. Next month's module is all about long-term care, so come back next month to learn more. That's the quick review of MAGI. What we're going to focus on today is non-MAGI benefits. And one of those benefits is called OSIP-M. That stands for Oregon Supplemental Income Program Medical. And that is full OHP benefits, but for individuals who are disabled or 65 years or older. OSIP-M CALM is the emergency only benefit package for that same group of people. And for these folks who are either disabled or 65 plus years old, we have something called Medicare Savings Programs. And that is a program, as you'll learn today, that helps people pay for Medicare. And under non-MAGI, people can also get long-term care. So regardless of whether you're under 65 or over 65, disabled or not disabled, long-term care is available to you. We're going to focus today on OSIP-M and Medicare Savings Program. Those are two of the major benefit packages that are available to individuals who are disabled or 65 years and older. So that is what we're reviewing today. So it's a thin slice, but they are important programs. So the big difference between them is that OSIP-M, as we call it, covers its medical coverage. It's full, well, it's OHP benefits, right? It's full OHP if you meet our immigration requirements, and it's emergency level OHP if you don't meet the immigration requirements, but it is medical coverage. Versus Medicare Savings Programs, or MSPs, is financial assistance. It's help paying for Medicare costs for individuals who have Medicare. So I want to pause for a moment and see if we have any questions. Are there any questions, folks, that I should be addressing right now?
I don't see any questions in the chat yet.
Okay, I do encourage people to type in their questions as we go, because the people who are my team who's monitoring the questions will bring them into the larger discussion if they will help clarify things that we need to clarify for everybody's understanding. We'll answer others later. So OSIP-M and MSP are both programs for people with a need, right? They need to be either 65 years old or older, or blind at any age, or disabled at any age. And we have the definitions of blind and disabled here for your reference if you'd like them. And the income limits are mostly based on an SSI standard. So SSI is Supplemental Security Income. A few are based on a percentage of federal poverty level, but they're mostly based on an SSI standard, a percentage of SSI standard. So it's just to point out, we're not going to go into the details on that, but to point out that different programs use different income criteria based on different standards. So if you see different numbers in income charts, that helps you understand where they come from. For both OSIP-M and Medicare Savings Program, resource limits apply, which means that we look at not just how much somebody is getting on a monthly basis for income or a yearly basis for income, but we also look at resources. What are their assets that they have in bank accounts, extra homes, extra vehicles, things like trusts and annuities. And that's a big difference between the standard OHP many of you are used to and this OSIP-M OHP, which is for 65 plus or disabled. OSIP-M OHP has income limits that depend on the individual situation. So it is not standard across the board. So if you see differing eligibility or differing income limits, that might explain why. Again, we're not going to go into all the details on that, but we did want to explain there's a lot more complexity on the eligibility and the income for these non-MAGI programs. So we do want to talk a little bit about what OSIP-M is. It is the name of the non-MAGI program for full OHP benefits. And there's also OSIP-M CALM, which is emergency only benefits for those who don't meet immigration requirements. But when we say OSIP-M, it is equivalent to OHP, except it's for those who are 65 plus or disabled, for the most part. Now, one evaluates for eligibility for MAGI first. That's considered a richer benefit in a lot of ways because it doesn't look at resources. So first, we look at, is somebody eligible for MAGI? And if they're not, then one evaluates them for non-MAGI. So you don't have to apply for OSIP-M separately. It's all done through the one system, and the system, like we talked about earlier, evaluates for one program and then the next, and it goes down the line to make sure somebody is getting all of their options that might be available to them. Something about OSIP-M that we wanted to point out also is that it can be retroactive for up to 3 months before the date of request. So it's the same thing with the traditional OHP, the MAGI OHP, 3-month retroactive coverage. We have the same permission or the same allowance for the OSIP-M. And in OSIP-M, individuals are enrolled in a CCO just like they are for MAGI OHP. So those are some of the things that we wanted to point out. And I believe we have some questions. So I'd like to open it up to our questions monitors.
So the first question is, what are the immigration requirements?
The immigration requirements are the same for all the programs. So we're not going to go, this is not a module on immigration, so I'm not going to go into all of that. But whatever you know about immigration requirements for MAGI OHP can be transferred over to the non-MAGI medical programs. So requirements are the same across the medical programs. Do we have any other questions to answer before we go on?
We don't have any others right now.
Thank you. All right, something else we wanted to point out is there is a term that you may have heard. The term is dual eligible. And dual eligible has a very specific meaning and definition. It means somebody who has both Medicare and Medicaid. So somebody can be on OHP Plus, which is the MAGI OHP, or they can be on OSIP-M, that's their OHP benefits, and they can have Medicare. That individual might be referred to as a dual eligible, and that's what we mean when we say dual eligible. Now, what we really wanted to point out today is that just because somebody has Medicare doesn't mean they can't have full OHP. In fact, they can. So somebody on Medicare can apply for OHP and potentially get that coverage. And in addition to that, they can also get help paying for that Medicare if they're eligible for those programs, the Medicare savings programs. So all of these pieces, the OHP, the Medicare, and the MSP can all work together and can all be in play for the same individual. We want to make sure that people know that. So Medicare savings programs are the next piece of it. So we talked about OSIP-M, which is OHP full benefits or OHP CALM benefits, depending on immigration status. And that's one of the programs available to folks who are 65 plus or disabled. They can also get Medicare savings programs, and they apply in the same place. It's all through the one system, through the applicant portal. So we're going to talk about MSPs. These MSPs that help pay for Medicare are not medical coverage, right? It's just financial assistance. It helps pay for the Medicare premiums, co-pays, and co-insurance. They can be paired with full OHP benefits or even CALM level benefits. One person can have both, but MSPs are not coverage. They are financial assistance. Now, an applicant must be eligible to receive Medicare or receiving Medicare to be eligible for these Medicare savings programs. Because that's what they're for. They help pay for Medicare. So they're not really relevant to anybody who isn't about to receive or receiving Medicare. Do we have any questions right now before I move on?
No additional questions in the question box, but I can keep monitoring.
Great. All right, so within this MSP, Medicare Savings Programs, we have different levels of assistance. And QMB stands for Qualified Medicare Beneficiary, somebody who's receiving Medicare. And depending on their income, they can be eligible for different levels of assistance in paying for that Medicare. So part one benefit of MSP is that it can help pay for Medicare Part A premiums. That's your hospital premium to cover your hospital stays. This is organized from highest benefit level to lowest benefit level. So QMB is kind of the tier one, the highest level. I'm sorry, that's not really true. Sorry, yes it is. QMB is in a lot of ways the highest benefit level because it pays for Medicare Part A premiums, the hospital premium. It also pays for Part B premiums, which is the medical or outpatient coverage. It also helps pay for Medicare co-pays and co-insurance. Okay? None of them pay for Medicare Part D, which is prescriptions. So that QMB gives you the most coverage, and you can have it along with other OHP or Medicaid. So you can have OSIP-M and this level of help paying for your Medicare. And we have the income limits for a single person or for two people who are eligible for these programs. Down at the bottom here, these are 2022 limits. Just to note, they change every year. But we're providing the income limits so you can see approximately where they are. SMB is the name for kind of the tier 2 level assistance. It does not pay for Medicare Part A premiums for hospital, but it does pay for Part B premiums, but it doesn't cover the other Medicare costs like the co-pays and the co-insurance for that Medicare Part B. So that's why the QMB, that tier 1, is a higher level benefit, and you'll notice that's a lower income limit. So people with lower income get a higher benefit level, right? SMB has a medium income limit, and it's less coverage, and that's very consistent with our other programs as well. And then SMF is the kind of the third tier. The only difference between SMF and SMB is that they have the same coverage, but with the middle tier, you can have other Medicaid, but with SMF, which is that third tier, you cannot have other Medicaid. So if you're at that higher income level of up to $1,529 a month for a single individual, it doesn't allow you to get that Medicare assistance, that Medicare payment assistance, if you have other OHP. So I hope that makes sense. But I want to pause, give you a chance to look at this and digest it and ask any questions. Are there any questions, Denise or Christina?
There are none in the question box yet.
Okay. I'd like to ask all of our attendees a question, which is, does this make sense to you, or would you like me to go over it in again or in a different way? And if you can type the answer to the questions box, that would help me know if I should move on or if I should linger here.
So there is a question in the chat, in the questions box. Does it change when including household members?
That is a question for our non-MAGI Medicaid policy analyst, Janelle, who I know is here as an attendee, having a hard time becoming an organizer, but she may be able to answer the question in our chat that we have to get an answer there. So Janelle, maybe.
Hi, can you hear me?
Perfect, yes.
Yay. Okay, yes, it does. It goes up with each individual for, there are different levels for each individual added within the household.
Great.
So these are the single and two, but it goes up to, I think, 10 and even beyond.
Thank you. I'm glad you're with us, Janelle. Thank you. Okay, I did have one request to kind of go over this again. I'm going to simplify it a little bit and say that when people are getting help paying for Medicare, they can get higher benefit levels and lower benefit levels. And we've tried to outline it by what is covered on each of these benefit levels. QMB, the first one, is the highest benefit level. It gives the most coverage because it covers both Part A premiums and Part B premiums, as well as Medicare copays and coinsurance. And you'll see that SMB and SMF do not. I think that's the big piece of it, is that at a lower income level, you might get help paying for not just the Medicare premiums, but also the Medicare copays and coinsurance. And for a single person, that income limit is $1,133, right? If you're over that, then you're not going to get help paying for the copays and the coinsurance or the Part A premiums. You're only going to have Part B premium assistance available to you if you're between that 1,133 and 1,359 as a single individual. So that's the big piece of it. And then that last column, SMF, is the same benefits as SMB. So level 2 and level 3 benefits are the same, but the requirements are different. The income requirements are different, and whether somebody can have other OHP or Medicaid are also different. Did that help? And do we have any other questions before we move on?
We do have a few other questions. The next one is, will there ever be a benefits for prescriptions?
Janelle, are you able to address that question?
So I can't really say if Medicare will ever add a benefit for prescriptions. I mean, that it's like prescription coverage. So we do have Part D that helps to pay for prescriptions, but as for just fully covering them, I couldn't say if they will. However, the state is working on a benefit for those who don't have prescription coverage. It's not something that I could answer other than guessing, and I would guess probably not.
Thank you. And I think
there's also a question that's asking, is that the income limit for household income or individual income?
So for the single individual, that would be the one where it's just a single person within the household. But each additional person that is included in the financial group, which can get complicated figuring out who that is, but it has to be at least the adult that's applying and their spouse, and can sometimes be children if it benefits those people. So if it's the adult and the spouse, that's the total income between the two of them. If there were 3 children added and the household, the financial group is looked at for 5 people, it would be the total income for all 5 people. So when we're looking at that, it is for the entire household that is included in the eligibility decision.
And Janelle, if that is a household of 5 people, would that income limit increase?
Yes. So it goes up, I want to say somewhere around 429 or something close to that for each additional person within the household.
And is that even if the additional people are not going to be eligible for this MSP?
Correct. So in the case where the spouse doesn't have Medicare, we're still looking at a household of 2 because that spouse is required to be on the case with that person. So it would be the 1,526, and we look at both people's total income for that 1,526 for QMB. If there are children in the household and they are included in the eligibility decision, then even if they're not receiving benefits, we're looking at their income, and it is included for the eligibility for the one person who may be applying.
And are the household rules in terms of who is included in the household for the eligibility decision the same for MAGI and non-MAGI, or are they different?
No, they can be very different. And even within non-MAGI programs, they can be different between the OSIP-M and the Medicare Savings Programs.
Right. So I think that's what I thought. And I want to highlight that without going into all the details of who's included in whose eligibility household, it may not be the same as what you're used to for the traditional MAGI OHP. So just be aware of that.
And I just want to chime in, that doesn't change who you put on an application.
Yep.
That's still standard.
Thank you. That's an important point. That's always the same for all of the medical programs, and it's included in the one applicant portal and in the paper application and in the application guide and in your getting started guide. And it is the foundation of an accurate eligibility determination. And then each program that's being evaluated will determine who's included in that equation. All right, should we move on? Okay, I'm trying to move on. Please click. All right, we wanted to also share with you some differences between OSIP-M and MSP. So we also included in this MAGI OHP, which is that traditional OHP for those under 65 and not disabled. So this is a little chart to show you some of the different benefits that are available under these different programs. So under MAGI OHP, it is medical coverage. It covers limited prescriptions, doctor's visits, transportation, dental care, limited vision care, of course, more for children and pregnant individuals. And but it does not help pay for Medicare costs at all. Whereas OSIP-M, which is OHP, but for 65 plus or disabled, it's the non-MAGI OHP. It is medical coverage. Yes, it covers prescriptions, of course, a limited list, not everything, but it covers prescriptions. It covers doctor's visits and transportation and dental care and limited vision care. And again, it does not help pay for Medicare premiums, coinsurance, or deductibles or copays. But Medicare savings programs, while it is not medical coverage and does not cover things like prescriptions, doctor's visits, transportation, dental care, or vision care, it does help pay for Medicare premiums, and how much it pays. It helps pay for Medicare premiums, and whether or not it pays for coinsurance and deductible depends on the benefit level. So this is your little cheat sheet to summarize some of the large and heavy text screens you saw earlier. I'm pausing for questions. And to let you review the slide. And now I'm going to move on. This is where we have some case examples. We wanted to outline some common scenarios and show you how they are handled and who might be eligible for what. And as we all know, we are not eligibility workers, right? We don't determine eligibility as ROCs. You don't determine eligibility as community partners. And you never need to know the eligibility rules, because what you do need to know is how to enter something effectively and accurately into the applicant portal, and then the equations behind that and the algorithms behind that do all of the work for you. But we know that you are better assisters, better informed, and a better resource for your clients when you understand some of these programs. So we wanted to outline some case examples. Because these have numbers in them and income limits, this is only relevant for 2022 because next year those income limits are likely to change as they do every year. But let's talk about the first scenario, full dual. So dual refers to dual eligible, somebody who is receiving OHP and Medicare. So let's say we have a 65-year-old individual, that means they're over 65. They are also disabled. They are receiving SSI, Supplemental Security Income, and they're enrolled in Medicare. They will be eligible for both OSIP-M, and if they meet the immigration requirements for full OSIP-M, for full OHP under OSIP-M, as well as the highest level of Medicare savings programs. And the reason for that is those receiving SSI are assumed eligible for both OSIP-M and for Medicare savings programs. So if somebody is receiving SSI, that's a really good indicator that they're probably eligible for a suite of these Medicaid programs. And of course, everybody should always apply, but this person really might have something available to them. All right, the next example is somebody who is just eligible for QMB, which is that highest level of help paying for Medicare. That same 68-year-old individual receiving Social Security benefits, not SSI, but Social Security, which is that's related to age, not, anyway, I'm not going to get into that, sorry. Receiving Social Security benefits of $1,041, and they are enrolled in Medicare. They would be eligible for QMB, that highest level of paying for Medicare premiums, copays, and deductibles. The reason for that is that the OSIP-M limit for a single person is $841. It's that SSI limit. So that person would be over income for that full OHP. But because the Medicare savings program limit for a single person, as we saw on a previous slide, is $1,133, they fall into that category and they would get that highest level of help paying for Medicare. Somebody who would get the lower level help paying for Medicare, meaning only help with the premium, is somebody who has a higher income limit, like $1,400 a month, and they're enrolled in Medicare. They're under that top limit of $1,529 that you can see on the right-hand column. So they can still get help paying for Medicare, but they're not going to be eligible for the higher limit, the higher level of Medicare assistance or for the full OHP. But something I really wanted to point out is this mixed eligibility couple at the bottom. This one is a little bit complex, so let's see if I can walk you through it. We have a married couple. They're both 68 years old. They're both on Medicare, but they have two different income limits. Person A makes $1,000 a month, and person B makes $200 a month. They have different eligibility for different programs. Because, and in fact, person A is only eligible for help paying for Medicare, that QMB. But person B is eligible for both OSIP-M and QMB. And the reason for that is that each person must first meet their individual limit for OSIP-M, and then meet the couple limit. So the first person, person A, does not actually meet the individual limit for OSIP-M for that OHP benefit, because they're making $1,000 a month, which is over that OSIP-M limit of $841. But person B, because of their individual income, does meet that individual limit as well as the couple's limit. So this has come up with community partners where folks say, well, why is it that a husband and a wife are applying and one of them gets OSIP-M and the other one doesn't? This is why. It's because of that statement in that bottom right square. Each person must first meet their individual limit for OSIP-M and then meet the couple limit. But QMB is different. QMB combines the couples with their income, and that limit for QMB is $1,526, so both are eligible for that. All right, I think I should definitely pause to see what questions we have.
We have one question. For Healthier Oregon, would a single person over 65 need to make under 841 monthly to qualify for full OHP regardless of immigration status?
I'm going to read that slowly so I can understand it. So for a Healthier Oregon, would a single person over 65 need to make under 841 monthly to qualify for full OHP regardless of immigration status? Yes.
I want to chime in and say there are a lot of different doors into OSIP-M that have different income and other standards. So not necessarily, but that would be one route.
Thank you. And I think the main point here is that when Healthier Oregon is implemented on July 1st, and these programs are open to more individuals of different immigration statuses, depending on their age, I don't believe the eligibility will not be different. It will be the same. Never mind.
Yeah, I think that's safe to say is that it's sort of if we were to assume they had an eligible immigration status before July 1, with a few really complicated and obscure situations where that's a little not 100% true, but more or less, is it would mirror someone who has all their same information, but if we take the immigration status piece out of it, that would be the eligibility factors.
But yes, so I hope that answers your question, Susan. Sorry, it's that's why we have Janelle here. The non-MAGI programs are still a learning place for us, and they're quite a bit more complex. So I always have to remember to proceed with caution. I don't know what I don't know. We also have a question here, which is in that married couple scenario, what would we suggest for the husband to do to supplement his insurance? And I don't have an immediate answer for that. Does anybody, who's an organizer here?
This is Christina. So one thing that I would suggest is I would highly encourage them to connect with the local SHIBA counselor, so Senior Health Insurance Benefits Assistance Program. And we have some links at the end of the presentation for some resources, but there might be other programs. So, you know, one of the things we were talking about is really looking at things, how they work with original Medicare, but there's also other like Medicare Advantage plans that might have some slightly better coverage than original Medicare. Like there might be some other options for them. And there's also other programs that would help them, for example, lower the cost of their out-of-pocket cost for prescription. So since so that's one of the things that I would suggest is I would suggest having them connect with a local SHIBA counselor, and we'll have some links at the end for you.
Thank you. All right. So I think this is a high-level overview. It's not an in-depth review of eligibility. I think we explained why, you know, we don't need to know eligibility, but we try to tease out the pieces that are at high level going to help you dialogue with your applicants and your clients about these programs. The big picture is that people can be eligible for multiple programs at once. Having Medicare does not prevent you from having other Medicaid. People should always apply because the one system contains so many programs and we don't know what they might be eligible for. So we never want to screen people out. We always want to have them apply. And we have a perception that these Medicare savings programs, help paying for Medicare, are really underutilized. It used to be people had to go to the APD office separately to apply for MSPs, and that step might have been missed. Now that they're all in one place, it makes it much easier. But because they used to be separate, we are concerned people don't know about them. So our ask to you is to listen for anybody who is 65 plus or disabled, regardless of what they're on, make sure they have applied for all the programs that they might be eligible for, especially help paying for their Medicare costs. So please listen for that where it may be getting missed and help people apply. That's one of the great benefits of community partners is you make more programs available to more people and you break down barriers. So that is really the the core high-level pieces we wanted to share with you today. We do have some extra resources, and I'd like to open it up for any additional questions.
I did want to do a little bit of a plug. This is Christina, by the way. I wanted to do a little bit of a plug. So in September of 2021, we had a module that talked a little bit more about Medicare and some of those other programs that aren't necessarily part of the Medicaid program, but that could help people with Medicare. So if you have a moment, go through group site and take a look at that module. It's from September 2021.
Great, thank you. All right, anything else before we wrap up? Or anything else any of our organizers or subject matter experts would like to chime in on? Oh, and I do see another question or two.
Yeah, so there is another question, and it's, so if a person 65 plus has dual coverage, but the OHP has ended, can our community partners still assist them?
What I'm hearing in that is that you have somebody who has MSPs, the OHP has ended, but MSPs are still a medical program in the one system. So the community partner, as far as I know, should still be attached to that person and can still assist them. Does anybody have any other information on that?
I just wanted to add in also that there may be situations where if you think someone has ended their OHP inappropriately, for instance, during the public health emergency, then we could definitely use our community partner tools to look into that and to see and make sure that that ended correctly. And that if people's situation changes, it's always a great step to help them reapply to if we think there's any possibility they might newly be eligible for OHP, or if they have an MSP, maybe if their situation has changed, they could become eligible for full OHP plus in addition. So it's a great time to report a change and see how that might be able to help someone.
And I do see one more question here that I'll read out and see if anybody wants to answer it, or I can. If someone is 65 plus with no Medicare benefits applied for yet, will this affect their application for medical benefits?
This is Janelle. It will affect it in that they are required to pursue getting that Medicare, but they won't be just outright denied. They'll be pended for them to go ahead and sign up for the Medicare.
Thank you. And we have another question. I'm trying to see if we are able to answer it. Is there a way to help individuals who would like to apply for long-term care, but they are under 65? I think there's a little more to that question about that person being in the legacy system. But if somebody is under 65 and they would like long-term care benefits, which is outside of the scope of this webinar, but I'll answer it anyway. Yes, they can still apply for long-term care benefits, whether they are under 65 or over 65, whether they are disabled or not disabled. They may have different eligibility criteria, and that program has some extra, I'd say, allowances, some extra generosities maybe. It can, depending on somebody's need, your income limit may be increased. And that is something we are going to cover next month in the July module on long-term care. So there's a good plug for coming back to learn more about the other programs that might be available to folks who need assistance with those daily activities of living. But anybody can apply for long-term care. We'll show you how to do that. It's also in the one system. It comes along with the other medical benefits. So you have to get onto MAGI OHP or non-MAGI OHP in order to get long-term care. It is not separate. But more on that next month. Right. I don't see any other questions coming in. So unless anybody has anything else to chime in about, does anybody else have anything else, or should we say thank you and wrap up?
Thank you, Deanna.
All right. Thank you, everybody, for being here. Thank you for listening, and we look forward to continuing to support you in all of your work.
Thank you, everyone.